Good day, everyone. My name is Navneet Anand from aajKal, local and global. Once again, the Greater Sydney has been in lockdown. Everybody trapped in their homes, working from homes. So we thought, why not? We have some positive vibes from Mr. Ravi Lochan Singh, President for AIRI India. Ravi ji, welcome to the show.
Thank you, Navneet.
मैं ना थोड़ा सा low feel कर रहा था, so I thought, why not I give you a call and start having a conversation to get some booster from your side.
Well, हम लोग भी लो बहुत दिन से फील कर रहे हैं. अब तो आदत बन जानी चाहिए थी, नवनीत. अब in fact, we have seen the way India has been over the last 1 year, not once but several lockdowns, so many deaths, whole lot of it. उन सब के comparison में Sydney is relatively still I mean, it's all right. I know we have 100 cases a day as an average, but we don't really see too many deaths or too many cases which can't be traced. Almost most cases have been linked to certain clusters. And I'm pretty positive that in another few weeks, things will be back to where they were, at least in Sydney.
I sincerely hope the same. पहले ये बताइए, have you got your vaccination done?
I got my first dose of vaccination done. Second one is due in another 10 days' time. And certainly I hope that after I'm vaccinated, I'll be allowed to travel.
Any side effects of the first one?
थोड़ा बहुत fever होगा, हल्का फुल्का, और body ache था, उसके अलावा तो कुछ नहीं. What about you? You've been vaccinated?
I've been vaccinated both the doses.
अब आप क्या कर सकते हैं vaccination के बाद? Can you travel?
I haven't tried me traveling के लिए अभी सोचा तो नहीं है, but हाँ, vaccination दोनों हो गई है. Yes. I would prefer to stay home still, because if I go out and carry something, there are still...
Totally with you. And why I asked that question, of course, we all know the answer of it. We can't possibly travel till bulk of the population is vaccinated.
Absolutely.
And in fact, if there is a hesitancy with anyone, that means we won't manage to get our goal. We have to encourage as many people as possible to get vaccinated. And only when the population is vaccinated, say more than 60% or 70%, can the government really try and experiment with allowing some travel to happen?
Well, I don't mind to be a guinea pig whom they do the test on, say, you go and travel and see what happens. Look, practically, when they were doing the second vaccine yesterday, they said there could be some side effects. हो सकता है cold and cough हो जाए, cough flu हो जाए, या temperature हो जाए, body ache हो. But trust me, there was zero symptoms that occurred to me. So probably my body has accepted.
Navneet, हम लोग देसी लोग हैं. इतनी तरह की बीमारियों के बीच में ग्रो अप किया है कि अब ये हमें इफेक्ट उतना नहीं कर रहा है. अब हमारे लिए फीवर थोड़ा बहुत हो जाना इज मामूली बात.
On a serious note, I think with the number of cases that we have seen in New South Wales, especially with the Greater Sydney, it grew up all of a sudden. There are some people saying it should have been contained by doing the full lockdown right in the beginning of July. But on the other hand, मेरे ख्याल से there's no hard and fast rule भी क्या करना चाहिए था, क्या नहीं करना चाहिए.
See, for most of the period of pandemic, I would say New South Wales has been an example for rest of Australia. So of course, when things go wrong, a lot of people start questioning why New South Wales should be regarded differently. But I think we've got to acknowledge that the state tried to be bold and brave and tried to chart out a path outside of the lockdown. And I think we should give a lot of credit to the way the state premier and the government has conducted itself. Of course, there is no shame in having a lockdown when it is required. And yes, I mean, it's part of academic research now, or academic study, whether lockdown should have been a week earlier or a week later. But what's or whether it could have been contained just in eastern suburb. It shouldn't have gone out. Those are the questions.
Exactly. Yes, this is exactly what I had in mind, that if the eastern suburbs would have been contained, वो शुरू में अगर वहां पे कम से कम, जैसे अभी हम देखते हैं अभी बैंक्सटाउन में या साउथ वेस्ट सिडनी में एक तरह का impose किया गया that they can't get out of their own suburbs. If it would have been done in eastern, probably बाकी सारे सिडनी को ये नहीं देखना पड़ता.
हो सकता है यदि आपने नॉर्दर्न बीचेस वाला लॉकडाउन देखा हो या याद किया हो तो उन्होंने काफी कंटेन कर दिया था, लेकिन वो ज्योग्राफिकली नॉर्दर्न बीचेस slightly differently organized. So उसमें क्या होता है कि you can lock it down, you can stop people from going into that area. That was the first round of lockdowns several months ago, जब हम लोगों ने contain करके, and then we managed to come back and bounce back. Eastern suburb is very much linked to the city too. It's not very far from the city, and in many ways, most of the cluster was around Bondi Junction, and then it did spread around here and there. But having said this, I think it's too late now to think about all that. What we need to think of is what will be next. And I think the government has taken a bold measure in terms of applying fairly strict lockdown in the 3 local government areas. I hope people follow it. There was a resistance in the beginning as far as following the government directives. And also, I believe the government has also applied the similar measure across Australia, across Greater Sydney, or Greater New Sydney and Wollongong and some of those areas. And we live in western suburbs. We live in, Western Sydney.
When we say we're trying to contain the virus, I think the easiest way is the vaccination to be done at a level so that it is finished as soon as possible.
Yeah, of course. And whatever we say and do, vaccination rate has always been very slow in Australia. Even right now, yesterday, I was just hoping that my sons and daughters son and daughter could take an appointment even for a couple of months later when it is available to them. It's not easy. You don't see it. You can't even plan when they can get vaccinated. And frankly speaking, whatever we say, it will still take at least another 6 or 8 months before vaccine supplies become more common.
At least I have seen one positive move among the people itself, that they're trying to go and book an appointment. The vaccination लेने के लिए अभी line लगनी थोड़ी जल्दी शुरू हो गई है.
We had vaccines. We should have done it. We should have simply said, you want to travel, get yourself vaccinated, and you can travel. See how many more people will take the vaccine. Make a rule. If you're traveling overseas, you can't come back for 6 months or 3 months or 4 months. कुछ करना चाहिए उनको.
This is what we are talking, that we need to travel overseas. If I go back to the education industry, the number of students that have been ready to come to Australia but have not been able to come, उनका क्या होगा?
In fact, almost all of them are vaccinated now. And because in India, the vaccination above age of 18 started some time back. And almost all of them will be vaccinated, both doses, in another 1 or 2 months' time. If you notice, bulk of our students from our offices across India, they are now looking at Canada and UK, not just looking at, they're actually going to Canada and UK over the next 2-3 months. And they've all taken the vaccines. And if one is vaccinated, they are even waived the quarantine when you arrive in these countries. So, I think Australia has built a moat around itself. It's living in a fortress, and frankly, nobody has an answer to it.
I don't know when would they start getting international students coming to this country. That's number one. Number two, will quarantine still be an essential for somebody who has done that vaccination, both vaccinations, as well as they've got a certificate which says they got negative in that?
It could be, but I believe they are trialing something in South Australia, that those who arrive from overseas with both doses of vaccine will soon be only taking 7 days quarantine, and that too a home quarantine option. So I think that's a trial, and I hope it succeeds. If there is no leakage from that model, I think that will become the norm.
And I really cross fingers. Because
I'm not, and I'm not yet. And Navneet, I'm not talking about students arriving on that. It's a trial regularly for any travelers coming into South Australia who are vaccinated both doses would be having shorter and different quarantine. It's a trial which is, I believe, it's already started or about to start. And if that is, and it's no pilot or anything that I'm talking about, it's a trial. So if that happens, that could become the norm across Australia.
Looking at the situation, especially with the private providers, chahe wo vet sector ho ya higher education ho, I think they are bleeding to a level that they would be dying by themselves without somebody has to close it down. Because inflow. So what do you see the future of these providers?
surprised at how many of them have survived till now, if you ask me. See, the universities will survive because they are government backed. They might reduce the number of courses, they might reduce the faculties, they'll probably pull along. But private higher education and private vet, I think till the time some onshore students are enrolling with them, it will continue. Because now with no job keepers or any such support for them, I think many of them will question their model now.
Looking at the number, as you said, onshore students, but the number of students in onshore students, क्योंकि वो तो धीरे 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 कम होते जा रहे हैं. As for the last 18 months, हमने overseas से कुछ देखा ही नहीं है. So it has to shrink, and it has already shrunk to a level that everyone is feeling that.
And Navneet, it should shrink. The purpose of education is not to keep studying forever. The purpose of education, it has to lead to something else. I mean, आपने देखा होगा, just yesterday, the government offered 40 hours work for those who work in retail. I mean, come on, are we just treating our international students as blue-collar workers? We need nurses, we give them hours. We need hospitality staff, we give them hours. Tourism, we give them hours. But come on, what are we promising to them after the COVID? Are we giving them a priority because they have been with us at the worst of our time? Should we not give them prioritized permanent residency in future, the way Canada has done? I mean, it's something I think we need to ask our own conscience. Entire city of Sydney has been in lockdown. Who has been providing you all these Uber Eats and food? It's our international students. Who has been manning our gas stations? It is international students. And now you're asking them to also keep working in the Woolies and the Coles and giving them full-time work rights because locals cannot attend to it. I mean, and I'm sure, let me ask you one more question. You went for your vaccination. How many, you would have seen most of the healthcare workers and vaccination staff are migrants, first generation migrants. Most of them came as international students. So in many ways, international students has kept Australia going over the period of pandemic. I believe they have really given some of the best years of their life in the worst situation when nothing else was covered for them. Many of them are not even covered on the Medicare. Now, where we really come down to it, this is the time for Australia to stand up and say, you guys, you have contributed. We should progress you on to higher points into the permanent residency.
When do you see the first lot of full plane of international students coming to this country?
I wish I was an astrologer because my predictions have gone wrong at least 3 or 4 times. And the way I feel is that we may not see international students till July next year.
Oh.
So this is where I come to. I don't also see international Australian population largely vaccinated till March next year. And I would hope that federal election is out of the way before July and political leaders on both sides of the spectrum have a little bit more risk-taking. We would have found ways of plugging the loopholes in our quarantine system. And hopefully we'll be able to encourage international travel. Again, Europe have started.
Hope sustains life. On this note, आज हमने की रवि लोचन सिंह से बातचीत और मैं आपका नवनीत. Ravi ji, thank you so much. You have been a booster for me. Thank you once again.
Thank you. Take care. Stay safe, Navneet. Take care.
You.
Bye.
One-stop answer to your Australian education and visa matters. Gemco Sydney. Dream big, achieve big.
Fiji Times. Be with the times.